Good afternoon. My name is Dr. Stephen Buchanan, and I've been a general dentist practicing in Oklahoma City for the past 25 years. So boomer sooner. There you go. I'm here to talk to you about my approach to Invisalign. And as I go, you're going to see some of the same theme throughout. I didn't know what they were going to talk about, but there's a thread that will go through here that you'll see when I'm done, and I'll address that. In the past, Invisalign, I've been an Invisalign provider since about 2003 when it just was in its infancy. And the thing about Align is that it took 10 years for Invisalign to deliver its 1 millionth case, and that was in 2010. It only took 3 years for the next million, 2 years for the next billion, and 1 year for 4 million. And it was 2 weeks ago that we just delivered our 5 millionth case, okay? Think about that. But when you think about that, that's just scratching the surface, okay? So here at Heartland, I know we do 2 weeks of Invisalign week. And how many of you guys have had an Invisalign day? Have you done that? Okay, went pretty well? Okay. And that's great. But I'm here to tell you, you can make it better. You can make every day Invisalign day, okay? And I'm going to tell you how you do that. For me, it was a paradigm shift in how I looked at dentistry. It was always restorative and perio, and I was just seeing things like my, fillings fail or crowns it just wasn't ideal. And so for me, I just started looking at the ortho first. And I learned this from Mark Hodge years ago. Instead of, when I do my first exam and I see the patient, I will say, instead of saying open wide, I'll say bite down, please. That's the first thing I do. And that gives me the big picture right off the bat. I know exactly what I'm going to find in there most of the time. So my paradigm shift was that I just realized that malocclusion is actually a pathology. Because if the teeth are not in the proper biological position, if they're no matter what work I do, no matter what restorative I do, it's going to fail to some point, okay? Just keeps going back. Not maybe all the way, but it's not ideal. And so if you have a commitment to lifetime care like we do here at Heartland, you're going to want to address that first. So how do we do that? The first thing I did was grow myself, okay? Take as much CE as I possibly can, okay? And get different perspectives. Dr. Donato talked about Dr. Galler's course, which I've taken. These guys all have different perspectives, and they're all great, and you can learn and just develop your own special way that you like to do things, okay? The other thing, the changes that we made is we take pictures on every patient. If you're not taking photos on every new patient, or even patients that have been in your practice for 20 years, I would recommend doing that. And we also scan every patient, okay? Some of you don't have scanners. I understand that. They are coming. But I guarantee you this, if you make every day an Invisalign day, you will get that quickly, okay? Scanning is a great educational tool for the patient. When the patient walks in and they don't know, and we're living in a digital age, and I have some patients that they'll ask, well, what is this? And I said, well, we just take pictures of your teeth and we can straighten them. And they're like, wow, really? Even if they don't need it, they may go talk to their friend. Hey, my dentist has a computer that they can just take pictures of your teeth and then they can get them straight. And even patients that I've had for years, we'll scan. And they may not do it that day, but at least you planted the seed, and they understand now why they need to have their teeth aligned. And I'll use I had a D, this is a true story, I had a D personality come in the other day, and we scanned him, and he says, well, I do a lot of public speaking, and I'm afraid I won't wear them. And my hygienist looked at him and said, okay, well, he cleaned his teeth, and he said, well, I'll think about it, but I just don't think I'll wear them. And she said, well, matter of fact, I've been wearing mine the entire time that I've been cleaning and talking to you. He says, what? He said, yes, you popped them right out. He said, well, when can we start? And she said, we already have, okay? We already have. And that's one thing I would do if your staff has a malocclusion or needs Invisalign, invest in it and get them in aligners. And if not, put them in a Vivera. And patients, you'll be amazed how many times, the one caveat to that is you got to make sure that they wear them. The worst thing is that you lean over and say, hey, show them your aligners, and they're not in, okay? You don't want that, okay? So, growing your staff, educate your staff, okay? We talked about teamwork. You could be the best clinician in the world and be the best clean checker, and you don't do any refinements. But if your staff is not on board, if you do not have a cohesive and seamless verbiage when that patient calls, adapt from your BAs to your DAs to your hygienist, it's going to be a struggle. But if you get everybody on the same page and you get them to buy in, the patients will be much more likely to accept treatment, and they will also be much more compliant. So that's very, very important. The other thing I would do is not only grow yourself or your staff, but also grow with your peers, okay? In Oklahoma, we started our study club. We call it ClinCheck Cafe. And so it's just a local organization, and my line rep called me and said, hey, let's start a study club. And I said, okay, we'll do that. We started small, and it grew, and it grew, and it grew. And in Oklahoma, we're doing pretty well in Invisalign. So what I would do, I'd suggest some of you more experienced docs, even if you've got just 50 cases under your belt, call your line rep on Monday and say, hey, I want to start a study club, okay? They will be more than happy to facilitate it, I promise you. But get out of the office, and just you'll develop a network of local doctors who you can all get together, look at ClinChecks, you can discuss struggles, and how to work through them, problems with ClinChecks, because I'm sure no one in here has ever had a posterior open bite, right? Okay? So it really gives someone, and then you have a group of doctors right there. I know we do, through Heartland anyway, have a on the intranet, but they can just call me on the phone, or I can call somebody else and get a direct answer. So those are the 3 things that I would recommend doing on Monday. Thank you very much.